Have you ever stared at the ceiling at 3 a.m. wondering if sleep would ever come? Or worse, dragged yourself through the day fueled by nothing but coffee and frustration? If that sounds familiar, you're not alone. Millions struggle with insomnia daily. What if I told you the solution could start tonight? Insomnia. It's not just about having a rough night here and there. For millions of Americans, it's a daily battle that leaves them feeling drained, irritable, and even sick. It affects more than just sleep. It impacts your health, relationships, and productivity. Today, we're diving deep into what causes insomnia, how to recognize the symptoms, and most importantly, how to treat it. By the end of this video, you'll have practical, research-backed tips to sleep better tonight. So stick around, this could change your life. Let's start with the basics. What exactly is insomnia? Simply put, insomnia is a sleep disorder that makes it hard to fall asleep, stay asleep, or wake up feeling rested. It's not just a bad night or two. Chronic insomnia is defined as difficulty sleeping at least 3 times a week for 3 months or more. But here's the thing. Insomnia isn't a one-size-fits-all problem. There are 2 main types. 1. Acute insomnia. This is short-term and often tied to a specific stressor, like a big exam or a breakup. Once the stress fades, sleep usually returns to normal. 2. Chronic insomnia. This is long-term and can last for months or even years. It's often linked to deeper issues like mental health problems or medical conditions. Relatable example. Imagine this. Sarah, a 35-year-old teacher, starts experiencing insomnia after a stressful semester at work. Initially, she blames it on the workload. But even after her vacation, she's still tossing and turning every night. This is where insomnia transitions from being acute to chronic. Okay, so what causes insomnia? It's not just one thing. Here's a breakdown of the most common culprits. 1. Stress and anxiety. You know that feeling when your brain just won't shut off? Stress and anxiety are among the top causes of insomnia. When your mind is racing, whether it's about work, family, or even just an awkward text, your body stays in a state of heightened alertness, making it nearly impossible to fall asleep. Research insight. According to the American Psychological Association, stress is one of the leading contributors to sleep disorders. And it's a vicious cycle. Lack of sleep increases stress, which makes it even harder to sleep. 2. Poor lifestyle choices. This one's tough to hear, but our habits play a huge role in insomnia. Screen time scrolling TikTok or binge-watching Netflix in bed might feel relaxing, but blue light from screens suppresses melatonin, the hormone that regulates sleep. Caffeine and alcohol coffee at 4 p.m.? That might still be in your system when you're trying to sleep. And while alcohol can make you drowsy, it actually disrupts the quality of your sleep. Irregular sleep schedule. Staying up late on weekends and sleeping in throws off your internal clock, making Monday mornings even harder. 3. Underlying health conditions. Insomnia often isn't the main problem, it's a symptom of something deeper. Chronic pain. Conditions like arthritis or back pain can make it uncomfortable to sleep. Mental health issues. Depression, PTSD, and anxiety are closely tied to sleep disorders. For example, studies show that 75% of people with depression also experience insomnia. Hormonal changes. Pregnancy, menopause, or thyroid issues can all disrupt sleep patterns. 4. Medications and substances. Did you know some medications can mess with your sleep? Common culprits include antidepressants, allergy meds, and even over-the-counter cold medicine. Always check side effects and talk to your doctor if you suspect your meds are keeping you up. So how can you tell if you're dealing with insomnia? Here are some of the key signs to watch for. Difficulty falling asleep. You lie in bed for what feels like forever, unable to drift off. Frequent night waking. Your sleep feels fragmented and you wake up multiple times a night. Daytime fatigue. Despite spending hours in bed, you wake up feeling exhausted and drained. Irritability or brain fog. You snap at small things or struggle to concentrate on basic tasks. Let's go back to Sarah, our teacher. She noticed her mood swings and constant tiredness were affecting her relationships and work. She even started forgetting lesson plans she taught for years. For Sarah, these were the red flags that her insomnia wasn't just a passing phase. Here's the good news. Insomnia is treatable. You don't have to live with it forever. Let's go over the best strategies to help you reclaim your nights. Cognitive behavioral therapy for insomnia, or CBTI, is the gold standard for treating insomnia. CBTI helps you identify and change negative thoughts and behaviors around sleep. Sleep restriction therapy might sound counterintuitive, but it involves limiting the amount of time you spend in bed to match the amount of sleep you're actually getting. Over time, this builds sleep pressure and helps you fall asleep faster. Relaxation techniques like deep breathing, meditation, or progressive muscle relaxation can help calm your mind and body. Sometimes, simple changes can make a big difference. Stick to a schedule. Go to bed and wake up at the same time every day, even on weekends. Create a sleep-friendly environment. Keep your room cool, dark, and quiet. Invest in blackout curtains or a white noise machine if needed. Limit stimulants. Avoid caffeine after noon and heavy meals before bed. While medication isn't a long-term solution, it can be helpful for short-term relief. Over-the-counter options like melatonin or prescription meds might work, but always consult your doctor first. If you're looking for non-pharmaceutical options, here are a few to try. Herbal teas like chamomile or valerian root can promote relaxation. Aromatherapy with lavender essential oil has calming properties. Magnesium supports muscle relaxation and sleep. Insomnia isn't just about losing sleep, it's about losing the quality of your days. But here's the silver lining. With the right approach, you can break free from it. Whether it's identifying and addressing the root cause, improving your sleep hygiene, or exploring therapies like CBTI, there are solutions. And remember, it's okay to seek help. Sleep is essential, and you deserve to feel rested and recharged. If you found this video helpful, hit the like button and share it with someone who's struggling with sleep. And don't forget to subscribe for more practical health tips. Let's make tonight the start of better sleep. See you in the next video.